All right, everybody, welcome back to another episode of the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today, we have Dr. Naseem Chatiwala. She is very decorated in the field of physical therapy and rehab. She is a certified vestibular therapist. She is a certified neuroclinical specialist. She worked at Spalding Rehab for over 10 years. She's also a professor at MGH and UMass Lowell. She is the co-chair of the American Physical Therapy Association of Massachusetts. She is the co-chair of the Concussion Task Force, and she, in 2021, won the Outstanding Achievement in Clinical Practice Award, and has also helped create guidelines for concussion testing and return to play from concussion testing. So we have a lot to talk about today on concussions, concussion management, why they happen, what the best practices are, what to look out for, etc. And before we get into that, I just want to let everyone know that this podcast is sponsored by Ascent Protein. Ascent Protein, one of the big things we love about this brand is their clean creatine. So it is a creatine monohydrate, and what we love about it is 100% sourced from CreaPure. So CreaPure is what is considered the purest creatine monohydrate available. And what that means is basically it doesn't have any creatinine in it, doesn't have any DHT or DCD, which a lot of generic monohydrate brands can have. It is also certified or Informed Sport certified, meaning if you are competing in any sport where there is drug testing, this will pass those tests and not have any banned substances in it. So, no further. Naseem, thank you for coming on today. And let's get into it. So I think the big thing, so we see a lot of athletes, and we don't generically treat concussions all that much specifically, but they are something we as physical therapists all kind of have to manage at some point with our patients. And I think parents too need to know the signs, the symptoms, and what needs to be done for individuals experiencing them. So we know more and more now about the long-term impact of these, but how does better management of them lead to a better long-term outcome? Or what could happen if someone is poorly managing a concussion from the beginning?
Yeah. Thank you, Brett, and thank you for inviting me to this podcast. My pleasure to be here and share some of my little knowledge that I have on concussion and concussion management. So that's a really good question to begin with, and long-term effects, they're definitely there. I think the first thing I would start is, if you have had a concussion and if you are experiencing symptoms which are past day 2, day 3, you definitely want to have active management for your concussion. Now, sports-related concussions may get better by themselves. If it is pediatric concussions, they will get better within 2 weeks, maximum 4 weeks. If it's an adult concussion, they may get better by themselves within 7 to 10 days. But any kind of lingering symptoms, they will need management. Because the problem is, once you have one concussion and you have symptoms, somehow in my practice I have found is having a concussion is like a magnet which attracts a second, a third, a fourth concussion. And sometimes I'll be talking to my patients and they're like, it's common sense, I should have not done that, but somehow they'll bump their head again. They might kind of hit something again and they get like a second, third concussion. So prevention is a very big key. And from all the research that has been done, what they have found is the earlier you can get treated for concussive symptoms, the better your long-term outcomes are. So recognizing that you have symptoms and then getting appropriate care definitely decreases your chances of having any kind of long-term effects after a concussion.
Yeah. And so I think a big thing too is people think it's always that you're whacking your head, but we know now that you don't actually have to make head contact at all to have a concussion. And right. As I learned when I was in PT school, and a great example was in the movie Concussion that came out when I was in school, you take a tennis ball in a glass jar and shake it around. That is your brain being concussed. It doesn't have to make contact with anything. So any kind of fast, jerky movements, reactions can also cause a concussion. correct?
Yes, and I think that's a big myth about people thinking about, oh, I did not hit my head. Like I treat a lot of people who are older adults, and we know how common the falls are in older adults. And my patients will come and say that, oh, I had a fall, but I saved my head from bumping. And so I don't feel I have a concussion. And I'm like, okay, did you kind of feel a whiplash in your neck? Do you have neck pain? Do you have strain in your neck? Do you have headache? And they're like, yes. So I'm like, chances are you kind of chattered your brain a little bit. So Brett, yes, you are absolutely right. And I like that analogy of putting a ball in the glass cup and shaking it and seeing. So what happens with a concussion is it's not, if you get a CT scan or an MRI done after a concussion, you're not going to see anything. Because if you see something, then that becomes a diagnosis of a mild traumatic brain injury. And that can be graded between mild, moderate to severe. In concussion, what happens is, so in our brain, right, we have all these neuron fibers with like cross connection, interconnection between our two hemispheres. But even within our hemispheres, there is a lot of connections that go from back of the brain to front of the brain, and all our centers, right? The visual center, the vestibular center, the speech, emotional, cognition, everything is all really well interconnected. When that concussion happens and there is this jarring of fibers, right? The neuronal fibers, what happens is they stretch and then they come back again. And that sets a cascade of like neurochemical, neurometabolic, ionic concentration changes. And these extra neurotransmitters, neurons, ions, is what causes these symptoms to come across after a concussion. So usually after a concussion, the thing was like you rest it out, you just sleep for like 7 to 10 days, and your ionic concentration is going to go back to normal and you're going to get better. We now know that that's not true. So after a concussion, we would say that, okay, maybe have rest for 24 up to 48 hours, but we don't want people to be resting more than that. We want active recovery. And that active recovery is you do small things around your house. It could be just getting up, walking around. Something that's not exacerbating your symptoms, but while symptoms are in control, you are able to do light aerobic exercises after 24 to 48 hours. And that's a key to find that protracted recovery doesn't happen. So you really, really need to kind of start doing some activities after 24 to 48 hours.
And is there a guideline for that too, of where it's okay for people to feel some type of symptoms? Almost like in the pain fields, we, a 0 to 4 out of 10 can be acceptable to work through pain. Is there a similar analogy to that for concussion management?
Absolutely, absolutely. So in concussion management, we are always educating our patients on how to have symptom analysis in terms of a scale. So it will be like a 0 to 10 scale. So a patient comes in and they're like, my headache is a 2 by 10. And I'm like, okay, fine. So we'll do an activity, maybe like example, going up on a treadmill and walking. And maybe after 5 minutes, the patient is like, I feel my headache is coming on more. And I'll be like, how much is it? It's 4 by 10. So that's still okay because it's only a 2-point increase from the baseline score.
Okay.
But then if they say it's 5, then that's more than a 2-point increase, and that's not okay. So in the concussion world, any increase in symptoms more than 2 points on the visual analog scale is considered, we don't want to do that. So we want to stop at that. And that's an education that you would give your patients when they go home, because when they go home, I'm like, go out for a walk, go out in the fresh air. But before you go out, think about, are you feeling dizzy? And if you are, rate yourself on the scale of 0 to 10. Are you feeling nauseous? Rate yourself on that 0 to 10. Are you feeling like foggy feeling in your head? Rate yourself. And then do you have headache? So these are like 4 signs that we always ask our patients.
Mm-hmm.
And then after they have gone for a walk, the problem with concussion is while you're walking, you may not feel the symptoms. But then you come back home and you stop your activity and all of a sudden it hits you and now you are in 6 by 10 or 8 by 10. That means what you did was way too much for your system could handle. So that's where we do a very guided return to activity protocol. So even if I know that my person can walk like 30 minutes, I might only start with 10 minutes. So because again, this is a classic sign of concussion is while they are in the activity, they will not know. It's after the activity is when it hits. And then we want to go slowly so that we kind of tailor the recovery in a successful way.
And then is there a baseline too of that's too high that someone shouldn't be doing activities, like they have a 6 out of 10 headache at baseline?
So that's another really good question. So yes, sometimes I have seen patients who have come to me with 8 by 10 headaches. And I think that scale is such a subjective scale that we have a headache, I might call it 8 by 10 and you might call it 2 by 10, right? So sometimes it's not just with one sign or symptom that we go by. I also look at a couple of other things, like what is their behavior, what is their mood, what is their stress level, what is their anxiety level, right? Because there's a lot of fear avoidance built into this. So I have treated patients even if they come by 6 by 10 headache or 8 by 10, but the choice of activities that I would do with a person will change. So if somebody came with 2 by 10, I might do some more dynamic exercises. And it also depends where they are in their recovery process. So if they come with an 8 by 10 headache and it's only like 2 days after concussion, I'll tell them don't come in today, just take some medication, put ice and do some other approach. But if they are 2 months out and they complain about this headache, I'll be like, okay, come on in because there are some other things I can do for you. And other things are also we do like meditation, breathing exercises, gentle yoga stretching exercises, stabilization exercises. Sometimes just like neck manual therapy. And all that will help relieve some of the symptoms.
Yeah. And that's another piece too. So I've treated a lot of concussion patients and we find their necks are all jacked up and can't move that well. So, what percentage, I guess, roughly would you say of post-concussion symptoms are related to like that, restricted C1, C2, or just, even lower mid-cervical area?
So another great point, and I feel a lot of times when you are treating concussion, right? Concussion is treated as a neurologic specialization. And a lot of therapists who specialize in neurological specialization are a little rusty on their orthopedic cervical spine skills, right? So this is where I feel like a team approach is a best approach. And I feel neck as a foundation. I was just listening to one of the education seminars which was presented at the CSM this year, and they talked about friendships. And they said, like the vestibular system and the visual system are very good friends. They're the best friends. They like to go hand in hand, everything together. But the cervical spine and the vestibular visual, they are friends, but they have a little jealous factor between them.
Okay.
One likes to move, the other thinks, okay, what is this person doing? And this one moves, the other person is thinking what they're doing, right? I thought that was just a very fun analogy of best friends versus J-factor friends. And I feel neck is such like that. Like neck is the foundation. Because if you don't have a strong neck, and there have been studies which have talked about stronger your neck, and they are really encouraging strength training for like sports specific, like adolescents, teenagers, like you should really, really work hard on your neck strength, because if you have a stronger neck, your recovery after concussion is actually much better and stronger. But neck as a foundation. So if I have a really strong neck and I have a stable neck, so it's not just strong, but it's also stabilization. This is where that C1, C2, like it's also about upper cervical versus lower cervical. And we really need to make sure that the upper cervical stability is intact, because then when my I do my vestibular exercises, if I do it on a stable foundation, I'll be able to progress my vestibular exercises much better. But if I'm trying to do my vestibular exercise and my C1, C2 or my cervical spine is not stable enough, then I'm moving something on a movable surface. And that's like very symptom provocating for these patients. And patients will report like headache, nausea, not feeling right, foggy feeling in the head, and they just don't know what's going on with their system. So usually when patients will come in after concussion, and this is where that symptom overload is present, I would just go for neck strength, neck mobilization, neck stability. And that's the foundation to getting more in terms of the visual and vestibular system.
And then looking at it kind of in reverse too of, okay, maybe you smash your head and you have whiplash and that creates a lot of tension and tightness and restricted mobility in there. But also for the person that's been dealing with this more on a long-term basis and they have maybe fear avoidance or they get that like full-headedness feeling when they tilt forward and things like that, and they neurologically create a lot of stiffness because of whatever's going on. So can the vestibular system and the visual system create orthopedic problems as well from poor eye tracking, poor reflexive stabilization and all that of the eyes?
Yes,
and everything
absolutely, absolutely. And so when we go into the chronic conditions, right? So now these are people who may be 6 months post or maybe a year out. And I've seen a lot of patients who are actually 2 years out. I'm actually treating a patient right now who had a concussion over 2 years ago, and he is struggling just with eye movements, and he's a physician himself, and he felt better and he was able to do everything. But when he's with patient care and he moves his eyes or head as he's doing the rounds, he would just not feel right, not steady. And so what happens with the vestibular system, right? This is where I feel it's a chicken or the egg, which came first. And so somebody had a concussion. The concussion may not have been as severe with the whiplash and neck was not involved severely, but the vestibular system was involved quite a bit. The way you manage symptoms of your vestibular system is by not moving your head. So if I'm moving my head and if I'm getting dizzy, I will either go very slowly or I'll stop moving my neck and I will do like a full body turn to avoid that vestibular stuff. And now over a period of time, maybe 6 months, a year, 2 years down the road, I have just compensated by not moving my head in some of these directions. Mm-hmm. And that led to neck stiffness. And we know what happens when you don't move, right? Motion is lotion to your joints. You don't have motion, you have kind of dried up your joints, and now you might also have an age factor. Maybe arthritis kicked in. Maybe your body type was very stiff to begin with. Maybe you have pre-existing like a psychological issue going on, or there is anxiety, some of these ADHD. Like there are a lot of factors that can also cause more stiffness, right? Mm-hmm. So this is where then your primary impairment of maybe just a vestibular system problem over a period of months to maybe a year or 2 years, now you're developing secondary impairments, and then it's like a whole blown effect, and now you have no idea what came. Sometimes they even forget that they had a concussion. I have patients coming and say that I just don't feel right. They just come with vestibular dizziness issues, and then on my intake I keep grilling with my questions, and then they're like, oh, I had bumped my head and I was not feeling right 2 years ago, and then they're like trying to then join the dots, and that's something what we do in our evaluations.
Yeah. I actually just had an interesting case too. I had a kid come in that I've seen him a few times for different issues that kept coming back in the same pattern, and it was all left-sided. And I looked at his body, and his whole right side was very overdeveloped. His right hip, his right shoulder, his right erectors, the right side of his neck. And digging, and I found out and then he mentioned he had had a bad accident, and it was about a year after that he started getting back into activities that he noticed this start happening. And he's like, one side of my body functions way better than the other. He had an orbital surgery, so he broke his orbital bone right around his eye, and he had to have all kinds of reconstructive surgery. And we found out like his eyes aren't tracking quite right. And so I think his visual system is a big part of what's going on with him biasing one side of his body. So I actually sent him to another specialist that deals a lot with that stuff. But just interesting how these things can all kind of come together. And he wasn't marked as a concussion patient ever, but I'm curious if there was something there, but he didn't.
I'm sure there is. Sure there is.
And then just to back up a little bit here too. So for parents with kids and things, we have signs and symptoms. So if we even suspect head trauma, we should be looking at these kids. Now, is there ever a time where we don't need to necessarily go get checked out at the doctor's office?
So it depends, like, you'll be surprised at how many concussions happen every day. And only a handful of patients are actually seen by physicians or nurse practitioners. Mm-hmm. So there are definitely a lot of concussions that go unnoticed. Mm-hmm. And these are not just sports-related concussions that happen in the formalized sports. I think athletic trainers and in schools, they have gotten really, really good at diagnosing or at least referring somebody with a concussion, especially in Massachusetts. I can't tell more for other states, but Massachusetts has become really good in terms of recognizing this. But outside of schools, right? So I see a lot of, we are just kind of ending our season of skiing and snowboarding. And so many of our friends and family and just people in general that I know in neighborhood, they'll be like, oh, we went skiing and my daughter or my son kind of bumped into somebody else, fell off. I think they got a concussion, but I don't think so. And they would have not gotten anywhere in terms of going to a physician or doing anything like that. So I do feel that a lot of concussions are going unnoticed and not getting to the physician. I would say that the biggest thing that if parents are listening to this or people who have had a concussion is, one thing that happens is I'm skiing, I fell, I bumped my head, I kind of shook the snow off, I stood up and I skied down again. And then they might just continue skiing that whole day. And at the end of the day, they sit in the car, drive back home, and this is where it hits them. And most times they'll be like, oh, I got really dizzy, I got very nauseous, and then it could be a precursor to protracted recovery. So a take-home message I always tell anybody is, wherever you are, if you bump your head, no matter how minimal it is, you need to get out of that activity, at least for half hour, 1 hour, analyze, evaluate where you are at, and then decide if you want to go back or not. But the consensus statement says that any kind of concussion that you get, you want to get out of that activity or that sport at least for the rest of the day. Mm. So that's a very big education point that I want to kind of try to spread out.
And then another thing too, the old myth is that I think might still is still a myth. Things change a lot in this field, but people used to not let their kids sleep. They said, "Oh, don't let the kid fall asleep if they've had a concussion." It's the opposite now, isn't it?
Exactly.
Yeah.
So first we started with sleep for 24 hours, 48 hours, almost a week. Before it was like you get a concussion, you get put in a dark room, nothing there, 6 to 7 days. So yes, that's absolutely gone away. The new thing is, if you don't have symptoms, so you're not feeling nauseous, you're not feeling any kind of dizziness, you don't have headaches, I think monitor someone with a concussion, but if they need to sleep, that's fine for them to sleep for a few hours. So it's not that you have to keep them awake. It's just if somebody is vomiting, then that's a big thing is we won't let them sleep.
Okay. What's the reason or what are we suspecting if they're vomiting?
So again, a lot of things that could happen in the brain. Mm-hmm. And then the other big thing is just in case of if they're throwing up and they're sleeping, aspiration is another big thing. Mm-hmm. So that's just another thing that you want to avoid. But otherwise, also with vomiting, there just could be things that we might be worried about in brainstem. And just anything changes in terms of their conscious level, in terms of their alertness, their motivation, their cognition, then that's our 911 call. So that's something that we really want to monitor closely.
Yeah. And so besides that, what are the signs and symptoms that someone should go get checked out by a professional?
Yeah. So biggest signs and symptoms are nausea, dizziness, headache, any kind of visual changes, blurriness in the eyes, double vision, any kind of vertigo. So when we call about dizziness, right? Dizziness can be multiple different ways. One is just lightheadedness. Other one is like rocking and swaying sensation. But then the third is a spinning sensation, which is like a whole other way of diagnosing somebody with BPPV. It's benign paroxysmal positional vertigo. And it's like a mechanical part to the vestibular system, meaning when you get concussed, some of the crystals, which are your calcium carbonate particles, can get dispersed and get into one of your vestibular canals. And whenever you change your head position in relation to gravity, those crystals in the canals move, which causes like a spinning sensation. But this is a short-lived spinning sensation. It only happens when your head position changes in relation to gravity. If you stop moving, the crystals stop moving, and you don't have that spinning sensation. There is a very effective canalith repositioning maneuver, which is for each canal is a different maneuver, and very, very effective. We treat those, it's like, I call it like a low-hanging fruit. You diagnose that, you treat that, your patient feels like 70% better just after one treatment, if that is present, right? So vestibular, we see a lot of different symptoms. Another point about the vestibular system is it's like a very small system. It's like sit right in your, behind this temporal bone. This is a temporal bone right here. And there has been some studies which have looked at when you hit your head, what part of your head gets hit the most. So they had these really fancy helmets that they put on all these football players and with motion the sensors and stuff. So they found is when people fall, usually people will land on the side of their head. So the temporal bone gets the most impact, and right underneath the temporal bone is our vestibular system. So people call it now labyrinthine concussions, which is concussion of the vestibular system. And that system gets jarred also. And that system is our motion detector system. So lots of vestibular issues when you have a concussion. But it also depends on type of concussion. The other symptoms to look for are fatigue. People just get tired.
Now, these are all things too that people should go get looked at for, even if it's just fatigue?
Yes. Because when somebody is having fatigue, what could happen is either their head is not stable on their neck. So suppose if I have a very weak neck and I'm holding my head in this position all the time, then some things are not working right. And fatigue can be a central fatigue symptoms when things are not working in the right way. So if there's too much fatigue, you definitely want them to get assessed. Sleep disturbances, either sleeping too much or sleeping too little, or waking up at night with a problem. I forget how many symptoms I already said. I don't know if I told headache or not, but headache is another thing. And then there is also balance and motor coordination. And I feel balance and motor coordination gets left out a little bit from concussion because people just view as concussion as all these symptoms of visual vestibular neck. I see a lot of patients with coordination issues after a concussion. And again, going back to all our fibers, which kind of cross between our hemispheres, right? And they are getting jarred. And so any of these complex level tasks, which require multiple systems working in our brain, they all get affected from a concussion. And then the last one is emotional, psychological factors. So memory, cognition gets affected. Sometimes speech gets affected, not in terms of how you speak, but in terms of word retrieval and what you are thinking. Metacognition, which is like thinking about thinking, high-level thought processes, executive function tasks. Like I had this one person and she's like, loves to host Thanksgiving dinner. And she's like, it's so easy for me to kind of let's like think about like multitask, make my grocery list, try to get what things I need and then have everything laid out, how to cook. All my recipes are all like on the table. And then she said, after my concussion, I just lost the way I plan of how to make this Thanksgiving meal. So she had to work with a speech and language pathologist, and then they kind of made strategies on how to kind of do these activities. So some of those could also be lost. And then the other big thing is aerobic capacity and heart rate variability. So usually that's kind of done with my autonomic nervous system. If I get on a treadmill right now, my autonomic nervous system will know how to kind of pair my heart rate to the activity level that I'm doing. After a concussion, some of this is lost. So either the heart rate goes too high or you get a blunted response and it's not going. And then that causes some of the other symptoms also. So again, and that's why it's called like a complex problem, because concussion, as you can see, is like so many factors that you need to consider. And then you would evaluate all of these, and then you would kind of do a targeted approach towards the patient. And I just thought about one more thing. Sorry. TMJ. So TMJ is like your joints, the mandible joint. And this is another thing that gets forgotten quite a bit. So think about it. You got a concussion, right? Like your neck gets affected. Sorry, go ahead.
I was going to say, for those that don't know what the mandible or the TMJ is, that is your jawbone and the joint of your jaw, basically.
Thank you very much. So this jawbone, right? So sometimes what happens is, again, patients may not know this and they will go to a dentist and all of a sudden they're like, you know what, my jaw hurts and I feel my jaw is like out of alignment, and they will come with jaw pain. And again, they may not relate this to their concussion. And when you interview them, when you evaluate them, you're like, okay, did you hit your head something? Did you feel something after that? Like, yes, this has happened 6 months ago. And since then, I just don't feel right? So again, any of the systems that don't work correctly in our body over a period of time, they are going to complain. And that's when you'll have to try to figure it out and try to fix it. So,
Yeah, and we see that a lot, like a lot of TMJ and cervical stuff, whether it be related to concussions or not.
Exactly.
Is that cervical positioning of a lot of people these days with our environment have a forward head, and that retracts the jaw up and can create symptoms of TMJ as well.
Right.
The dysautonomia thing is something I think a lot of chronic people with concussions deal with this, and I've had a lot of people that have dealt with this, and one of my family members actually deals with this. So you bring up HRV, though, which is an interesting point. So heart rate variability, and a lot of fitness trackers these days can somewhat accurately track those things. So now, will people with post-concussive symptoms typically have a lower HRV?
Yes. And again, it depends. Like I have seen on the flip side is sometimes they have higher HRV and then they don't know what to do.
Okay.
So I've seen it both ways. But what happens is when you have someone with heart rate variability, right? And these are the patients where you might see is they may even have this heart rate variability when they go in a sitting position or lying position to standing up position. And you might not just look at heart rate, but you're also looking at blood pressure. So sometimes there's blood pressure variability also.
Yep.
And that's what you need to do. So there is like a tilt table test that you would do for these patients. And then there is a protocol on how you would treat them. And so it will be week 1, we're just going to do like supine exercises. Week 2, you might do some sitting exercises. Week 3, and then you just keep changing position, and then you can do it. But some of the patients who are more higher level and who have like just a little lower heart rate variability, you can directly take them to something called a Buffalo concussion treadmill test. And then that test will tell us how they are doing at different heart rate zones. And it will also tell us about where their symptoms are with their heart rate going up. And that gives us a baseline of where we can start somebody for training them for this aerobic capacity.
Interesting. So that's another piece of, if someone is experiencing these types of symptoms of changes in blood pressure, heart rate variability, shortness of breath can kind of be in there too, I've seen. How do we go about, is there a place where we have to work through some of these symptoms as well, and then just monitor, the volume or the time and the intensity, and then scale based on that?
Absolutely, absolutely. So usually the symptoms that we go with are those 4 symptoms, right? Headache, foggy feeling in the head, dizziness, and nausea. Mm-hmm. And we have something that's called WORMS, which is the vestibular ocular, I'm blanking on it right now.
Motor,
yes, symptoms, thank you. So when you do the WORMS, right, and you'll kind of rate everything. Then on the Buffalo treadmill test, like they go at like 3, 3.2, 3.4 speed, and then you'll just rate them as they go.
We can monitor these things and return to activity, right? And then kind of my question to that too is, okay, we can work through these. And do you think the devil is in the dose? I know with exercise in like orthopedics, people say, I'm not ever going to deadlift again because I got hurt doing deadlifts. It's like, well, was it the deadlift or was it the amount of deadlifts? Just like I tell patients all the time, exercise has a therapeutic dose range just like medication. So you might take a Tylenol for a headache, right? But are you going to take the whole bottle? No, that would kill you. The same goes for exercise. And so is it the same in this realm of, okay, maybe I walked 30 minutes and it was too much and it hurt or it got worse. That doesn't mean we shouldn't walk anymore, right?
Right. And I think so. There is a lot of education with this, and we definitely want to make sure that person that we are working with who has a concussion understands the dosage, because dosage is a key. And I can tell you both sides of this. One side of it, which is that fear avoidance, and they absolutely don't want to do anything because, again, anything that they do brings on symptoms. And so my education is, okay, we're going to do it in small bursts. So we'll do like 2 minutes, 5 minutes. Sometimes we even do like as little as 30 seconds, and that's enough for that day. So we start very, very small dosage, and a lot of it is habituation and then getting them back into their functional activity. I do have other set of patients who are my overachievers and who love to kind of do more, and they love and nothing for a wrong thing. It's just their body type is such that they want more, right? But the education here is, I just had somebody and they're like, oh, I felt so good. I've not felt this good since my concussion. It's almost 6 months out. And I felt so good. So then I decided to go walking, and then I did some gardening. I went hike. I did this. And then when I came back home, it hit me so hard. I had to lay in bed for next 3 days. Mm-hmm. So the problem with concussion recovery is when you start to feel better and when you start to doing activities, when you are in the moment, in the activities, it's not going to complain to you. You'll feel fine doing the activity. But it's like after you have stopped the activity, that's when it hits you. And that's why that education is, I know you're getting better. We still have to have a little more patience. I only want you to do 20 minutes. And what I tell my patients is, on your cell phone, put a timer on. Let it beep after 20 minutes. And even if you're enjoying the walk, even if it's really, really nice outside, everything is good, I still want you to stop that activity and take a breather and rest. And then we're going to resume something else in half an hour. Mm-hmm. Same thing is for socialization aspect of this, right? So I know we didn't talk a little bit about noise sensitivity and light sensitivity, but these are 2 other symptoms that some of the patients may have. And then when they're feeling better, they're like, oh, I was able to hang out with my friends, or I was able to go to a restaurant. But if the restaurant gets too noisy, too crowded, or you spend too much time in there, while you are in the moment, you'll be fine. As soon as you get home, that's when it's going to hit you. So again, planning, thinking about it, organizing yourself, and then little is actually better in terms of concussion recovery initially.
And then, the light sensitivity, everything too. So that's one thing of like avoid blue light, avoid the TVs, the computers, the electronics, whatever. Is that still held true? And is it we should avoid them for long periods of time? Like, should we get back to them sooner than later? And even if we are a little symptomatic, or
right. So what happens with light sensitivity is a lot of times patients would start wearing sunglasses or dark glasses to avoid lights. And I think the consensus statement and what has been shown in research is you're protracting recovery by using some of these devices, like even headphones doing noise cancellation, right? So what we want to do is, in terms of how much patients can tolerate, we want to kind of habituate them to the lights, right? So we actually tell patients not to wear those dark glasses. We are like, okay, let's kind of expose you to some of the lights. If the symptoms come in, maybe we'll take you out and we'll put you in a softer lights or something like that. But we want to start exposing them from day 1, day 2, day 3. The problem is, if we take this person who is tolerating about 50% of lights and give them those dark glasses, now we took them out from that 50% and made them 100% without any light exposure.
Yeah.
Now when they have to come out of those dark glasses, now it's like a whole big thing that they have to do, right? So the idea is that we don't recommend using glasses anymore for these patients.
And don't be a vampire. Okay. And then another thing too, like, so my cousin is married to a guy that used to play in the NHL has suffered, I think, 5 or 6 concussions and ended his career basically in the NHL. And he was still dealing with symptoms 5-6 years post hockey era and a lot of rehab. Are there people that there just has to be this expectation that they have to live with these symptoms forever, or do you feel everyone can recover from a concussion?
I do feel everybody can recover from a concussion. I do know of some concussions that just take really, really long time to recover. And there might be some cofactors with them. Mm-hmm. I feel if we work with a targeted approach for every individual, there might be a chance that the concussion may not have recovered, or there might be something that might kind of not allow that symptoms to have the full resolution. But I also look at quality of life and what the patients want to achieve functionally. And so far, even though some patients may live with some symptoms, their quality of life has been changed drastically by what we can do for physical therapy or any kind of team approach, right? So it's not just physical therapy, but I work very closely with occupational therapists and speech and language pathologists and nurse practitioners, psychologists, because again, I think it's a full team that can help some of these patients. I have a patient who is actually a retired football player. He's an NFL football player. And he has had multiple concussions, and he lived with them for over 20 years. And when I first saw him about 5-6 years ago, he was in a wheelchair.
Wow.
Unable to walk and had so many symptoms. And at that time, we didn't know what was it, because again, it was multiple concussions, but then there was some other neurologic problem we thought was going on. But he has been dedicated to work with this since last 5-6 years. And now he's like walking up and down everywhere, dancing, moving around. There are days where he still doesn't feel good, but his quality of life has changed 100%. And he's able to do a lot more. So I would say that there is no reason that someone should think that, oh, I have had a concussion and I'm not going to get better. I don't think that's there in our dictionary. I feel everyone, if given a chance, can improve their quality of life.
Yeah, absolutely. And then my last piece here, I know you have to go in a few minutes, the aspect of nutrition. So I've heard a lot of like functional medicine practitioners and things mention that a lot of concussive symptoms will bring, or a lot of things that happen from a concussion with the metabolic cascades and everything, will bring on a lot of gut issues for patients. And a lot of gut symptoms people aren't correlating back to the head injury. So can you speak on that a little bit, and what we should, or people should look at how to manage that?
And I love that you're thinking about this, and I actually really like the thing that you shared about your sponsorship. I forget the name of that company, but the protein, I think that's so important. Nutrition is very, very important. I don't feel specialized in terms of like the gut, and I don't feel I have as much knowledge to kind of connect that. I have not looked at recent research. But just from my anecdotal experience and some things that I already know from being on the concussion task force, because we talked about nutrition over there, I do feel that things start in the gut, right? Like Parkinson's, that's what they talk about, is everything starts with the gut. And I feel the gut has such close relationship with not just your brain, but also your vestibular system. So one of the big things is, we were talking about it, is people who are pregnant get nauseous in that first trimester. And why are they getting nauseous in that first trimester, right? Because there's some things that are connected actually to their vestibular system, which causes nausea. And so people who have vestibular symptoms after concussion, the reason they get nausea is because, again, of that connection between the vestibular system and the gut. Mm-hmm. Again, very interesting stuff to know. Don't ask me beyond that, because I don't have that more knowledge on this. But in terms of nutrition, like, I also feel is for brain health, right? Like after a concussion, what we're trying to do is we are trying to kind of get our brain back in the homeostasis, right? Because this whole neurochemical, neurometabolic changes that have taken place, and this is this big ionic concentration changes that happens at that neurotransmitter level, we're trying to get that back in homeostasis. And for that to happen, you really need to have really good nutrition for your brain health. So people after concussion, we are always recommending for them to have a really good diet. And Brett, I can send you, we had created a document on the ANPT concussion task force, which I can share with you. And it talks about what kind of foods to eat after a concussion. Lots of fish, lots of fatty acids, lots of protein, and then lots of water. So definitely you need to have really good nutrition.
Yeah, I would say there's a lot too with even like the fish we have these days to supplement with a really good fish oil supplement. Like we carry some ones from Standard Process that are really, really good. But, and also like maybe to go to a functional medicine doctor that can look at a lot more in-depth of your blood labs and everything else and see if there's something missing because of what's happening in the brain. The brain rules everything of, you know, our vitamin production, absorption, this and that. So, all interesting stuff here, but I know you got to go, so I will let you go here. So Naseem, if people want to reach out, where can they find you? Where's your clinic?
So if they need to reach out to me, I am based in Acton, and I have my own private practice, Rehab Health 360, and we specialize in treating patients with concussions, vestibular disorders, neurologic disorders. In addition, we also have now hand therapists, pelvic floor, so we're trying to do more things. Awesome. Here. And they can go to our website, www.rehabhealth360.com.
Yes, and Naseem is one of our trusted providers that we've been sending some patients to now for a little bit. And Naseem's also helping us learn some more things about the vestibular system and the neurological system. And it's been great to work with you guys. So I appreciate it. And thank you for coming on today.
Thank you so much. Thank you for having me.
Of course.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit arkitectfitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.